Hello everyone, my name is Andrew Dang and today I will be discussing the rise of antibiotic-resistant, also known as super gonorrhea. As I'm sure most of us know, gonorrhea is a sexually transmitted disease. It can affect anyone who is sexually active, especially those who have multiple sex partners. It can affect men and women, but men who have sex with men are at increased risk for gonorrhea infection. Symptoms may vary from person to person, but can affect the throat and mouth, genitals, and rectum. In men, this includes discharge from the penis, pain during urination, and swollen or painful testicles. Women can experience vaginal discharge, bleeding, or painful urination. Rectal infections typically exhibit similar symptoms, including pain, discharge, itching, and bleeding. Some people never experience symptoms while infected with gonorrhea. Women are particularly more likely to have an asymptomatic infection. Testing for the disease involves a simple swab or urine test, and it is usually curable with the use of antibiotics. You may have seen news reports or social media posts discussing the threat of killer or super gonorrhea. While these phrases are surely alarming, super gonorrhea is most simply antibiotic-resistant gonorrhea. In 2010, the CDC issued guidelines for the treatment of gonorrhea. It followed a two-pronged approach: one dose of a cephalosporin antibiotic followed by a 1 gram oral dose of azithromycin or 7 days of twice-daily doxycycline. 2 cephalosporin antibiotics were recommended, either oral cefixime or an intramuscular injection of ceftriaxone. However, in response to data demonstrating an increased gonorrheal resistance to cefixime, the CDC revised their recommendation in 2015. Ceftriaxone became the preferred cephalosporin treatment, while cefixime was only used when ceftriaxone was unavailable. A major revision occurred in December 2020 when the CDC recommended that gonorrhea should be treated with a single drug, recommending only a 500 milligram dose of ceftriaxone. The CDC noted increased data supporting that gonorrhea was becoming resistant to azithromycin and that there seemed to be little resistance to ceftriaxone. Finally, they also stated that the week-long treatment of doxycycline should only be used if chlamydia infection cannot be ruled out. The CDC's narrowed approach to treatment reflects the rise of antibiotic-resistant strains of gonorrhea and a more judicious approach to prescribing antibiotics. Antibiotic-resistant gonorrhea poses a risk on both public health and individual levels. As discussed in the previous slide, treatment options have declined from 4 to 1 in the last decade. This poses a massive threat to the nation, considering gonorrhea is the second most common reportable disease in the United States. Nearly half of the gonorrhea cases in the U.S. are resistant to at least one antibiotic. This resistance has occurred rapidly over the past few years, as demonstrated by the CDC issuing a new, more restrictive treatment recommendation just 5 years after the last one. On an individual level, gonorrhea can have serious effects that last beyond the initial symptoms. Notably, it can lead to infertility in both men and women. Additionally, the open sores caused by gonorrhea can put an individual at an increased risk to bloodborne diseases, including HIV. Preventing the spread of antibiotic-resistant gonorrhea is a public health interest that is of both epidemiological and biological importance. Unfortunately, antibiotic resistance in gonorrhea and other pathogens is increasing. We must take steps to mitigate the spread and growth of existing strains while preventing the rise of new antibiotic-resistant strains. This can be accomplished on a both individual and on a larger systemic scale. Individual steps can include preventing yourself from contracting the disease and avoiding spreading it to other people. Systemically, the use of antibiotics should be regulated and monitored. Not only should recommendations and guidelines be issued to prevent increased antibiotic resistance, but these guidelines should be clearly communicated to healthcare providers. Finally, education is something that needs to be done on both an individual and systemic level. We will discuss the individual and national steps that need to be taken in more detail on the next 2 slides. The only way to completely avoid gonorrhea infection is to refrain from engaging in sexual activity altogether. Otherwise, preventing the contraction and spread of the disease is the next best thing. Maintaining a monogamous relationship in conjunction with testing can prevent you from contracting gonorrhea. For example, when you and your partner decide to become monogamous, you can both get tested to ensure that neither of you have gonorrhea or any other sexually transmitted disease. Proper and consistent condom usage is always a good idea, but especially when you have multiple sexual partners. Additionally, certain populations should get tested more often. The CDC recommends that men who have sex with men should get tested yearly. They also advise women with multiple sexual partners or all sexually active women under the age of 25 should get tested annually as well. Of course, if any of your sexual partners have been recently diagnosed with gonorrhea, you should get tested as soon as possible. Similarly, you should inform all your sexual partners if you have recently been diagnosed with gonorrhea. Maintaining an open and honest dialogue with your partners regarding sexual health can help prevent the spread of gonorrhea and all sexually transmitted diseases. Preventing the spread of gonorrhea, killer or not, is a two-way street. While preventing the contraction and spread of gonorrhea is in our hands, our healthcare providers also play a role in preventing gonorrheal antibiotic resistance. Physicians and other healthcare providers should stay informed on the latest recommendations and guidelines concerning the treatment of gonorrhea. Healthcare providers should be aware that while antibiotic resistance may not affect this patient or the next, improper antibiotic use will lead to more difficult to treat cases of gonorrhea. Antibiotics should be used judiciously and intentionally. Providers should refrain from prescribing antibiotics like azithromycin and doxycycline without proper testing. On a national level, the Centers for Disease Control and Prevention have enacted programs and strategies to ensure that we stay ahead of this constantly evolving threat. One of these is called the Gonococcal Isolate Surveillance Project, or the GISP for short. This program collects specimens obtained from various STD testing sites from around the country and tests these specimens for antibiotic resistance and responsiveness to various treatments. These data are sent to the CDC, who use it to determine the best forms of treatment for today's gonorrhea. Additionally, the STD Surveillance Network, or SSUN, monitors a selected sample of reported gonorrhea cases to ensure that patients are receiving the proper treatment for the disease. Programs like these increase physician accountability while ensuring we have access to the best treatments for gonorrhea. Finally, nationwide education programs can help educate both providers and the general public on how to prevent gonorrhea and antibiotic resistance. Clinicians should be educated on the most updated treatment suggestions, while individuals should be educated on how to prevent spreading the disease in themselves and their peers. Preventing the spread and impact of antibiotic-resistant gonorrhea is a cooperative effort that will require a comprehensive public health, biological, and social approach. So, what are the main takeaways here? Quote-unquote killer or super gonorrhea is most simply antibiotic-resistant gonorrhea. Gonorrhea as a whole is extremely common, with painful and grotesque side effects. It can even lead to infertility or increased risk of HIV infection. Antibiotic-resistant strains of gonorrhea have evolved due to excessive antibiotic use in the treatment of gonorrhea. While the CDC has recommended a new treatment plan as recently as December 2020, options remain limited. To avoid contracting gonorrhea, we should practice safe sex, including condom use, STD testing, and limiting your number of sexual partners. Healthcare providers should always follow the recommended treatment for gonorrhea and stay updated on this constantly changing situation. Finally, the CDC and other health organizations continue to fight the threat of antibiotic-resistant gonorrhea by implementing new programs and research to stay ahead of the bacteria. While we do have reason to be concerned, simple and intentional steps can be taken to prevent the spread of antibiotic-resistant gonorrhea and to ensure the health of Americans and people worldwide.